You know when you smash your finger in the door or you hit your toe against something and you know it's going to be like a second before that nerve impulse hits your brain and is really painful? Well, that's what happened with this patient in today's video. His sheet in bed tore off his nail one night, and part of it is sticking up at a 90-degree angle, and he was really afraid to come in. So I was able to get him very comfortable and smooth out the nail, and now he's my best friend and he's going to come in on a regular basis. So enjoy the video. All right, so I'm just going to trim some stuff off here. If it hurts you, let me know. I don't think it will, but I can numb your toe if I have to.
I'd rather you didn't have to, because that's the shot is what hurts the most.
Exactly.
When?
So that big piece that was sticking up is gone. That's already gone. But most of this nail is not attached. So when you said that 54 years ago, not that you're counting or anything, that you had a procedure done on this,
I had an ingrown toenail.
okay? And what when you say the doctor butchered it, what do you mean?
Well, you saw what it looked like. I had an ingrown toenail on this big toe, too.
Okay.
Different doctor.
All right, so what happened was you took the edge off and it grew back? It wasn't the permanent procedure?
This guy on the right foot ripped out, cut off, and ripped out half of the nail. Hurt like hell. No bedside manner. I was a 14-year-old kid, scared to death. There's a lot of other aspects to the story I'm not going to bore you with.
Okay.
Went to a different doctor for the other toenail. He cut the nail down to a triangle like this.
Okay.
And it grew back so twisted and bent and screwed up and it never really stopped hurting.
Okay.
So
he didn't do what he said was going to be a permanent removal of it. He just caused you a lot of trauma.
I don't think he'd ever done it before.
Okay.
I think he was learning as he went. That's why they call it a medicine of practice, right?
Well, I would hate to think that. He just made it up as he went along, but
1967,
I'm going to start over here.
You have a nice touch. Thank you very much.
You are welcome.
I went to a podiatrist, what was it, dear, about 5-6 weeks ago, and his testosterone factor was pretty high. The third toe where you're working right now, he cut my toe, he made it bleed, and when he came to my big toe, by God, he was going to show that big toenail what he could do, and it hurt like hell. It took me 2 days for that discomfort to go away.
Well, does this feel better now when I press on it?
Oh, it feels great.
Okay. So what we're going to do is I'm going to just smooth out the nail that's left here. We're going to do the antibiotic for your legs, which will also help this area.
Sure.
And then what I would say is at your convenience. There's no rush. But, just first of all, for the caregiver, just keep watching it. And if it looks like it's getting any more red or smelly or, there's green discharge coming out, I want to see you back right away.
Okay.
All right, there's still a piece of nail here that I should be able to just go, gone. Okay. So.
Should we be putting a Band-Aid or something over this?
Yep, so do you have any Neosporin or bacitracin, any kind of antibiotic?
Yeah, triple antibiotic.
Okay, so just put that on for the next, what's today, Friday? So through the weekend, just put that on with a Band-Aid. And that should take care of much of this redness, especially because we're going to be putting on an oral antibiotic, okay? And then at your convenience, when you come back, we can remove that nail permanently. And what it takes is one little stick here, one little stick here for the anesthetic. Puts the whole toe to sleep, and it's really not a painful procedure when we're done.
And what is,
That will get rid of the nail, the whole nail, for good.
and then how does it grow back?
It doesn't. We make sure it doesn't.
Really?
Yeah, so that's an option.
When? Take it out from under the manifold and so forth, but how do I,
So when,
how
you
do I
know,
live without a nail in my big toe?
oh, very easily. It's not doing anything for you. It's, you know, mostly it's leftovers from when we used to climb trees and,
Conversation piece.
yeah. We don't need the nail, and what happens is the skin underneath just toughens up like this once everything's all healed.
Well, I know that Medicare will allow me to have my toenails clipped every 9 weeks.
Yeah,
So should
so
I
that
just-
would be another option, so.
Should I just come back in 9 weeks?
Yeah, and then we can just
And
make
then-
sure
and
that everything's looking good and discuss whether that's something you're even interested in doing.
Well,
Is something gonna continue to grow now, or is
Yeah.
it so dead that?
No, that nail will keep growing.
now, am I plagued with this, I forget what they call it, fungus something or another?
Well, right now, yeah, you probably have it in some of your nails, but right now, given the amount of swelling you have,
Yeah,
that's the least of our issues.
okay.
We need to get this swelling managed and the infection in the soft tissue. And I'll send a letter to your primary and just let them know, he or she,
Okay.
let him or her know what we're doing.
Did you write that on that
I did.
stenciler?
Yeah.
Okay.
Okay, yeah.
He's he's a very good doctor. I'm very pleased to finally find somebody like him. I'm very pleased to find you.
Well,
You
thank
were
you.
highly recommended.
Thank you. All right, I'm just gonna smooth out all these nails so they don't catch on your sheets like your other one.
Well, we changed the bedding.
Ah,
Well, you have really put me at ease. And as Aaron would say if I weren't here, that's a remarkable achievement
Huh.
all by itself. I have had a lifetime of trouble, not a lifetime, but I've had a lot of trouble within the medical world getting good care.
I'm very
So,
sorry
I'm-
to hear that history.
Well, you know, stuff happens. But I am very pleased from everything you've said and done here. I'm so ticklish.
Sorry.
But I apologize.
No, I'm not trying to torture you here.
Yes, you are. It's,
Why would I do that? Your Google review will be less good if you think I'm torturing you.
it's just, my toes are very ticklish.
Um,
Well, anyway, I was just trying to throw out a compliment to say that
Thank you.
it's very nice to have somebody who takes a kind interest in what's going on. And it's one of the reasons that I try to find female doctors, because my current primary care physician, Dr. Stensler, is an exception. He's a very nice man. He's very kind, he's very thoughtful.
Do you know, when I first started in practice about 30 years ago,
Yeah.
my Yellow Page guy highly, highly encouraged me to put my picture in my Yellow Page ad, which I really didn't want to do. But he was right. He said, there are people out there specifically looking for females. And other than the couple, you know, people who called to ask me out for a date, I was way thinner and cuter back then. So, okay, so let's just kind of recap here. Your nails are fine. Keep the antibiotic with a Band-Aid on this left big toenail, just through the weekend, I think should be fine. Call if there's any concerns with it. And then we're gonna get moving, we're gonna get you an antibiotic for the severe swelling in your legs and your feet and the redness, and then we're gonna try and get the lymphedema nurse to come out and start working on this lymphedema. If we find out that your insurance won't cover it, then we'll prior authorize this compression pump that will squish all the fluid out.
Will Melody be sending that prescription over to Walgreens?
I will.
You
I will do that right now.
okay.
Yep.
And you put the correct Walgreens,
Okay.
okay.
Any questions about any of this? Anything?
I'm sorry, I didn't think to bring his other regular shoe.
Oh, no, that's fine. That's fine. All right, well, thank you for letting us do the video, and what we'll do is,
Oh, you've already done that?
we're done, yeah.